And now on the line is Sheila Gilheany. Sheila is the CEO of Alcohol Action Ireland. Sheila, welcome back to Near FM.
And thanks very much for having me on, Darren.
Okay, Sheila, we spoke together only a week ago on Near FM, and we spoke in that interview about alcohol companies and their marketing of zero alcohol drinks. There are two reasons why we are doing another interview on Near FM so soon after our last interview. The first is that this week there was, from your point of view, great news announced about health warnings on alcohol drinks. Can you tell our listeners today, Sheila, for those who don't know, more about this issue of what's in the news about health warnings?
Surely. So way back in 2018, there was legislation passed which said that alcohol products being sold in Ireland would have to have health information labelling, placed on them. And it has taken quite a long time to go from that legislation being passed to actually seeing what the regulation, what the label would look like, and the various the legal process that had to go through about that. But this week, the government announced that they had signed into law the exact regulations that are required. So this, the label now will say they'll have to give information about the calorie content in an alcohol product, the amount of grams of alcohol in it, and then warnings about a link between alcohol and fatal cancers, a warning about that alcohol causes liver disease, and also a warning about not drinking in pregnancy. And alongside all of that, there will be a link to a public health website, askaboutalcohol.ie. So that's the label. That's what has been finally gone through all the various regulatory processes around that. It had to go through EU processes as well. That was signed into law. It was announced on Monday. Businesses will have 3 years to actually bring it into place. So we're still some way off actually seeing it on a product, but we are getting there. And this actually is a very, very significant step, because for the first time, actually globally, that there is a mandated label to give comprehensive health information about alcohol products. And it is a significant step, and we would certainly hope that other countries will be following suit.
I don't know a lot about this particular issue about health warnings, Sheila, but as regards wine companies based outside Ireland, would you see the argument that for them having to put health warnings on wine bottles solely for the Irish market is a big inconvenience and may encourage many of them to stop exporting to the Irish market?
Well, firstly, actually, many different countries have different regulations around the labelling of their products. So, for example, France would require a pregnancy warning label on its and any products that are sold there. So also does Australia, so does America. So at the moment, wine companies and indeed all alcohol companies are already producing different labels for different jurisdictions. So we see no difference in this. We certainly would hope that all jurisdictions would eventually move towards, full health information labelling across that. But right now, Ireland is leading the way in this quite comprehensive label that is being required.
As you were saying there, it'll take 3 years for it to actually to come into effect. But within those 3 years, it's possible that there could be a cross-EU policy on the issue, couldn't there?
Well, what we would certainly hope is that we know that it is under discussion in the EU at the moment, and we certainly hope that our move here in Ireland will actually act as a spur to that process.
Okay. Okay, Sheila, there was also a report in the national media earlier this week in relation to the watershed on alcohol advertising on television. That is also, I believe, from your point of view, great news also. Can you tell our listeners more about this, Sheila?
Absolutely. So again, this dates back to 2018 and to the Public Health Alcohol Act. And one of the measures within that act was to have a broadcast watershed, so that basically you shouldn't see alcohol advertisements on TV or on radio before 9 p.m. at night. There's particular hours that's worked out there. And, again, this is something passed way back in 2018 and still not actually implemented. But there was a report given actually was reported in the Irish Examiner that the Department of Health stated, and this is the first time that they've actually stated this, that it would be implemented before the end of the year. And, we see that definitely very encouraging, and, we're very pleased to see it. I will just say that there's still outstanding bits of the legislation that have yet to be implemented, and a very important part of that is the nature of those advertisements that we see. So the legislation would require controls on the content of alcohol advertisements. So basically they have to be fairly factual, that they can only give a statement of, where they're manufactured, things like that, and, not to be invoking the sort of myths that we see at the moment. Now that's separate again from the broadcast watershed thing, but it's an important one. And eventually, I think we will see the full implementation of this act against what can only be described as ferocious opposition from the global alcohol industry.
Am I right in saying that the watershed policy, if it comes in, it could be enacted before the end of the year, but it might take a year to actually come into effect? Is that the case, is it?
I think it could be, but I don't. We just don't have the details of what exactly, because we have to see what does get published, by the Department of Health on that.
Okay, you mentioned there the content of alcohol advertising. Are there any other outstanding areas of the Public Health Alcohol Act 2018, Sheila, that have not been enacted also?
No, I think that's actually kind of the bulk of it at this stage. What is needed actually then is, kind of a review process, to look at that. So, for example, things like MUP, the rate was struck at a particular level, that basically says that one standard drink would cost €1. There is scope within the Act to go back and look at that again, 3 years after the full enactment, and to be able to say, should this be revised? Should this be looked at again? So there is a kind of an ongoing process that should be happening around that as well. And the reason why that's important is that, gradually over time, the value of something like an MEP rate will be eroded through inflation. And we would know, for example, in Scotland, they're actually going through that similar process now, because that was kind of built into their legislation, that 3 years after enactment, they would have to look at it again and see should it actually be increased, or what was the efficacy, or how has it actually been going. And we would be very keen to make sure that, I suppose really, that it would be operated automatically in line with inflation.
And the two policies as regards television, the watershed and the content, they're also, when they come in, they'll also be reviewed. I think it's 3 years, so they could be strengthened also. It's even possible that in the future we could still have a policy of zero alcohol advertising on the media. That could still happen, could it?
Well, we certainly are working very hard on this, because we think that the legislation as it stands should outlaw zero alcohol advertising in the way that it is being done at the moment, because one of the things that's actually in the Act that where it makes a definition of what is alcohol advertising is simply using a statement of the name of an alcohol producer. And there's no question to us that that's what we're seeing at the moment with these zero alcohol products, because they are using the name of an alcohol producer like Guinness or like Heineken. So we would argue that the legislation as it stands does cover this. If we're wrong in this, and I accept, I'm not a legal expert, and I could imagine maybe there is some argument about that, but we would certainly say this needs to be looked at and tightened up if it doesn't fully cover it.